Most of us use music as a way to unwind after a long day, but did you know it's being increasingly utilized as a powerful medical intervention? From assisting stroke survivors in regaining their mobility to unlocking suppressed memories in dementia patients, the clinical applications are fascinating. Joining us today to explore this further is Dr. Elena Rossi, a specialist in neurologic music therapy. Elena, welcome. To start with, how would you distinguish music therapy from simply listening to a playlist to boost one's mood?
Thank you for having me. That's a crucial distinction to make. While listening to music is undoubtedly therapeutic, professional music therapy is a goal-oriented, evidence-based clinical practice. It isn't just about entertainment. It involves a credentialed professional who tailors musical interventions like rhythmic auditory stimulation or vocal exercises to address specific physical, cognitive, or emotional challenges.
So it's far more structured than a casual hobby. Could you elaborate on the diversity of patients who can benefit from this approach?
Certainly, the scope is remarkably broad. For instance, children on the autism spectrum often find music a more accessible medium than traditional speech. In aged care, we see profound results with Alzheimer's patients. Music can bypass damaged areas of the brain to trigger long-term memories. Furthermore, for those suffering from severe trauma or clinical depression, music provides a nonverbal outlet to process complex emotions that might be too difficult to articulate in words.
You mentioned stroke recovery earlier. Is there a specific case study that highlights how this works in practice?
One particular case comes to mind, a patient named Julian. Following a significant stroke, he struggled with a condition called aphasia, which impaired his ability to speak. However, because the brain processes music differently than speech, Julian found he could sing lyrics, even when he couldn't say them. By using a technique called melodic intonation therapy, we eventually bridged that gap, helping him transition from singing phrases to speaking them. It was a major breakthrough for his independence.
That's truly remarkable. However, I imagine there are still some skeptics. What are the most common misconceptions you encounter in your field?
The biggest myth is that you need to be musically talented to participate. In reality, no prior musical background is required. Another misconception is that the therapist just plays relaxing music. Sometimes we use high-energy, complex rhythms to stimulate brain activity or help a patient work through anger. It's a highly personalized process based on the patient's specific neurological needs, not just their favorite genre.
Looking ahead, do you envision music therapy becoming a standard component of integrated healthcare?
I firmly believe we are already heading in that direction. As neuroimaging technology advances, we can actually see the brain lighting up in response to music. This scientific validation is encouraging more hospitals and rehabilitation centers to incorporate music therapists into their multidisciplinary teams. It's no longer viewed as an alternative treatment, but as an essential tool for holistic healing.
Dr. Rossi, thank you for sharing your expertise with us today. It's clear that music is much more than just background noise.
My pleasure. Thank you for shining a light on this field.